Okay, so that is the example that I gave you a while ago, the 50 milligram divided by 0.1 milligram per liter. So if a dose of 50 milligrams, so the VD, volume distribution for drug A, is 500 liters. So the question that we need to answer is, how is it that the volume of distribution of drug A is far greater than any actual compartment volume? Bakit nangyari yon? It's because the drug A is extensively distributed to other parts of the body. Remember again the reason: some drug are distributed to the plasma, some are evenly distributed also to the rest of the body. So in this situation, it is due, ayan, yung 500 liters na yan, it is due to extensive tissue binding of drug A in the rest of the body. So if we add 50 milligram of drug A, resulting in plasma concentration of 0.1 milligram per liter, so conceptually, this is the same as adding 50 milligram of drug to a single compartment of 500 liters. So basically, your volume of distribution abstractly, kaya nga sinasabi natin it is known as the apparent volume. Abstractly describe this in terms of the plasma as a single lone compartment. It is not an actual volume. Kaya nga theoretical, kaya ginamit natin yung term na apparent volume distribution. It is not an actual volume, so it may be much higher than any real body volume because it is based on easily measured parameters. VD is an essential component of many pharmacotherapeutics equation. So again, how do we compute your VD? Okay, again, the formula is VD. How do we calculate? Is the amount of drug in the body, divided by the concentration, over the concentration of drug in plasma. So that's how you compute your volume of distribution, amount of drug in the body divided by the concentration of drug in the plasma. So what is the indication if the person has a low VD? Okay, what is the indication? Okay, if you have a low VD, it suggests that high drug in the plasma. So it gets where needed. Okay, high drug in the plasma. Whereas if you have a high VD, high volume distribution, what does it mean? Okay, what does it suggest? There's a less drug. Okay, less drug that is of course floating in the plasma. Less drug floating in the plasma. Less drug floating in the plasma or the water. Maybe the drug is a fat soluble. Okay, meaning they stick into the fat tissue. An example, okay, if you swallow 120 milligram of drug in the body, and we have 20 milligram per liter of drug in the plasma. Okay, so 120 divided by 20, you'll have a volume distribution of what? 6 liters. An example of your high volume distribution, if you swallow 120 milligram in the body, and you have 1 milligram per liter in the plasma or the fluid component of the blood, you'll have a VD of what? Okay, you will have a VD of 120 liters. So that is the concept of your volume of distribution.